All right, guys. I hope everybody's having a good night. My name is Dr. Heather Moore, owner of Total Performance Physical Therapy. We're going to talk about why does your knee pop. So many of us sound like a bowl of Rice Krispies, a little snap, crackle, pop. When you go up and down the steps, maybe when you're bending your knee, maybe when you're straightening your knee, maybe when you're going down a squat. Some people will even report it in their shoulders. So let's talk about this pop.
Yeah,
this is something we need to be concerned about. What is it? What do we do with it? So first of all, if there's a pop and there's no pain, meaning you're going down a squat and you just notice every time your knees go crack. Unfortunately, as we age, this does happen. And unfortunately, as we get older and we become more aware that it's popping, we pay more attention to it. Therefore, it seems almost like it's popping more, but it's just that you have actually become more aware of it. So it is not a bad thing if it pops and you don't feel any pain. So if you are kind of squatting or you don't feel pain, that's okay, not a big deal. It is usually this bone, which is your kneecap. It's usually tracking wrong, all right? So what that means is sometimes as you go down the squat, it may not fit perfectly in the groove.
Oh, you're welcome.
And as you age, the cartilage on the back of that knee starts to degrade also. So you want to be aware that that snapping or that popping could be just that rough surface of the cartilage, or of the kneecap, rubbing up against the rough surface of the actual bone behind it. So you get more of a popping sound because it's not as smooth as it usually is as it goes over the knee, or as you bend your knee. So that's one of the reasons that it could be. It's just a rough surface going on a rough surface. The other reason it could happen is because this is not sticking correctly in the track. So there's a track that it goes up and down, and you can't really tell too much when you're doing it. But if you were to really put your hand over your kneecap and feel it move up and down, it goes in and out of the track. So if it deviates a little bit one way or the other, it can cause a pop. So those are two things that can cause a pop with that kneecap. Another thing that also could cause it is more muscle tightness and pulling on that kneecap. A lot of the popping that you're going to hear has to do with that kneecap. Now this is popping again. What we're talking about, this is popping where it is not painful. This is not, it may be a little bit twingy, but it's not something that you've injured yourself. You've fallen and you've heard a pop. You tripped and you heard a pop. This is something that you heard every time you go to squat, your knee pops. So if you hear a pop in response to running and you twist your leg and you hear a pop, that could be a ligament that is going, that unfortunately has torn. Could be a muscle that is tearing. So a pop associated with an injury, meaning you fell, you tripped, you were running and you felt something pop. That's completely different than what we're talking about where the knee pops when you go down to squat or when you're bending it, not aggressively, not really doing anything, but you notice that it's starting to pop. So another reason that you have this pop is because there's tight muscles. And again, those tight muscles are pulling on that knee and taking it out of that track, which can also cause, anytime that kneecap kind of moves either side to side on that track, it can cause a little bit of popping just because it's not lined up smoothly, and you'll hear some of those pops. Some of them are louder, some of them are softer. But tight muscles on the inside or outside of the knee can also cause that continuous pop. Now, again, not something to be really worried about if you have that happening, especially if it's not painful. If it is painful, you really do want to pay attention to it because that means there's usually something more going on and there's something that we need to figure out and we need to address. However, you do want to make sure that you try and minimize the pops. And how we minimize the pops is by doing some knee stabilization exercises, by doing some knee loosening. So we're going to loosen up the muscle. I'm going to show you how to loosen up the muscles, and we're going to talk about some stabilization exercises we can do. So to minimize that popping, you want to start just by doing some single leg balance. Now you can start by doing this on the floor, nice and easy, eyes open. Okay, this is a good thing to do when you're brushing your teeth, all right? So you're able to do it. You don't have to necessarily plan a time to do single leg balance. Just stand there, brush your teeth. When you get really good at it, you can close your eyes. You want to be able to do that for about 30 seconds, all right? You want to do about 6 times Once you get really good, you can put a pillow underneath your foot. But you want to do that about 30-second hold. You want to do 6 of those, working up to getting those eyes closed, standing on a pillow. The next thing you're going to do is what we call hip hikes. Now this is, you're going to look at this and say, is this really for the knee? It's for the hip, but the hip affects the knee. So if you're not stable at the hip, you're going to get some of that looseness in the knee. So for a hip hike, all you're going to do is stand on that one foot, just single leg balance. If you really want to challenge, you're not going to hold on to anything. You're going to keep that knee straight, all right, that you're standing on. And all you're going to do is drop your hip down and then raise it up, and then drop your hip down and raise it up. You're not bending and straightening the knee. You're just dropping down and raising up, and dropping down and raising up. You want to do 3 sets of 30 of those. You're going to feel a burn really in the standing leg, not in the leg going up and down. Again, it is not bending and straightening the leg. You're standing on this leg, does not move. You just drop your hip and bring it up. Drop your hip and bring it up. And then the final thing you want to do is loosen those knee muscles up. So IT band, adductors are really culprits in that popping sound. So you want to make sure that you loosen that up. Now, we go through foam rolling. If you look at our YouTube channel, Total Performance Physical Therapy, we have a ton of foam rolling videos. So I'm going to show you something a little bit different. This is a BC bar that you can use to roll out your muscles. You can also use a rolling pin. This is very aggressive. So if you're not used to rolling out, you can start with a rolling pin that's nice and flat. But if you do a rolling pin, you're like, I don't really feel anything. That's when you're going to get something with these spikes on it. So you're going to start, you just sit in a chair and you just push on your quads, on the IT band, on the inside of your leg, and on the back of your leg, okay? You want to go above and you want to go below the knee and even behind the knee. Now, if you still are doing this and you're pushing as hard as you can and you don't really feel anything, you can go and lay on the floor and do the same thing where you're really pushing on that and just breaking up all of the knots. Now, if you feel a knot, like a tight spot, but like, oh, that's really sore, you want to stop on it just for a couple seconds and then keep going nice and easy. But again, you want to make sure that you're rolling everything nice and easy, trying to get all those knots out. That tightness combined with that weakness often causes a lot of that popping, and what it can take what was once uncomfortable and make it more, what was once comfortable, make it more uncomfortable. So again, not something to be overly concerned about, but certainly not something to ignore. It is signs of something that is coming. If you or someone you know is suffering from knee pain and wants a free consultation with a doctor of physical therapy, all you have to do is call our office at 215-997-9898, and we'd be happy to get you in. Thanks and have a good night.